Hi, thanks for joining us today. I am Dr. Susan K. Boolbol, and I am the System Chief for Breast Program and Breast Surgical Oncology at Nuvance Health. And today we're going to be talking about the importance of screening mammograms. And to join that discussion, we are fortunate enough to have Dr. Madhavi Raghu, who is a breast imaging specialist at Nuvance Health. And thank you so much for joining us today. We all know that one of the most important things that as women we can do for our overall health is obtain screening mammograms. Can you talk a little bit about that?
Thank you, Susan. Thank you for organizing this, and thank you for bringing this important issue to light. As we know, October is Breast Cancer Awareness Month, and it's really important for our patients to start thinking about breast cancer screening. Breast cancer is an important health issue. We have 1 in 8 women that will be diagnosed with breast cancer, and we want to take care of these patients before their symptoms are clinically apparent. And that's where screening mammograms come into play. So we want our patients to start screening mammograms at the appropriate age, which is usually 40, and we want them to get them every year. And it's important to get these screening mammograms because we want to find these cancers before they are clinically apparent and before women develop symptoms.
What exactly is a mammogram?
A screening mammogram is a type of study that utilizes low-dose X-rays to image the breast. So when women come in for their mammogram, we typically obtain 2 views of the breast, of each breast, for a total of 4 views. And those views, those images, are interpreted by the radiologist. And that will allow us to look into the breast and try to find any underlying lesions or cancers that might need to be treated.
And really, what are the benefits of having a mammogram, and are there any risks?
So there are lots of benefits of having mammograms. It's a screening study. And the most important benefit of having a screening mammogram is finding cancers early, before they become clinically apparent, before they become symptomatic. And the reason for that is cancers that are found on screening mammograms have really good outcomes and really good prognosis. And that's why we want to find those patients and treat them early. That may allow them to obviate certain type of treatments, like maybe they can avoid chemotherapy. In some cases, perhaps they can have certain type of breast conserving surgery so that they can maintain their quality of life. In some patients, perhaps, radiation may be elective because the cancer was found so early. But there are different options for patients, and so we want those cancers to be found early so that we can give them the best possible chance of treatment and prognosis.
It sounds like there's a lot of advantages to having a mammogram. Are there any risks or disadvantages?
So one of the risks associated with breast cancer screening or for a mammography is what's called false positives. So in other words, when a woman comes in and has a mammogram, sometimes the radiologist may see something and may question it. And so the patient may have to return for some additional imaging. And in a small proportion of patients, a biopsy is recommended. Now, if everything turns out to be fine, then that's great. But really, those who criticize screening mammography bring up the point of emotional stress and some of the psychological stress of being called back and potentially having an ultrasound. Now, all of that has, while that is an important and legitimate critique of breast cancer screening with mammography, I'd like to point out that the actual number of women who actually get recall from screening is a very small proportion. It's less than 10%. And of those 10% patients, a very few subset actually undergo biopsy. So overall, the benefits of screening mammography clearly outweigh some of these risks. The other risk that's associated with screening mammography is radiation dose. Mm-hmm. And I'm going to tell you that there has been 0 data about patients actually developing breast cancer from having serial yearly mammograms. It does not happen. But what does happen is that we're able to find these cancers early, and that's important.
And no, those are incredibly good points. And as physicians who treat women with breast cancer, these are things that we hear all the time. And there are so many myths out there. One of the reasons why we want to do this series is to get some of the truths out there and really eliminate the myths and the perception that people have of mammograms. So on that topic, there's so much confusion and variation as to when women should begin to have mammograms. I mean, I hear all sorts of different things. Can you help clarify that and clear up again some of the myths?
So there have been lots of studies that have actually looked at the benefits of screening mammography, and particularly the reduction in mortality rates amongst women from 40 all the way up to 75. And many of these studies have shown that there is clear benefit in screening women aged 40 to 49. And starting at 40 is actually very clinically relevant and important, because that's the first year, that is the age when the incidence and the risk of breast cancer actually starts to become clinically significant and apparent. Now, this does not fit every patient. There are some women who may have a strong family history of breast cancer or may have other risk factors that may put them at additional risk for breast cancer. And those patients may need to come in a little bit earlier. So those are patients that don't particularly fit this particular set of guidelines. But for the average risk woman who has a 15% or less risk of developing breast cancer, we recommend starting breast cancer screening at age 40 and to continue every year.
That's enormously helpful. What I'm hearing you say is that it's really not one size fits all, but for most women, 40 is when they should begin. How do I know if I'm someone who should start getting mammograms earlier?
So that's a great question, Susan. So there are lots of risk factors for developing breast cancer, but there are also lots of other factors that we just don't know about. And what's really important is to first and foremost discuss with your clinician, with your doctor, and really discuss your risk for developing breast cancer. Perhaps there's a strong family history of breast cancer, and what that means is first degree relatives. So we talk about a premenopausal mother or sister or daughter, in some cases, or brother or father, because men can get breast cancer as well. So that's important to keep track of. If a patient has had prior history of breast cancer, or if they've had radiation treatment to their chest for lymphoma leukemia when they were children. So there are other risk factors for developing breast cancer. And what's really important is to have a good conversation with your clinician to really tease out what these risk factors are. And that will give a patient a good sense of when they should start screening.
I think so much of what I'm hearing you say is that it's important to involve your physician in these discussions. And it's critically important to have the discussions and understand what your risk really is. You know, in line with talking about risks, what about dense breast? So say I've been told that I have dense breast tissue. What does that mean? And do I need to do anything different?
So dense breast tissue is an important aspect of a screening mammogram. What that really means is that a woman's breast tissue is comprised of fatty elements and sort of some of the more structural elements. Now, what we see as radiologists is that when a woman's breasts have more than 50% of these structural elements, what that does is it masks the underlying cancer. So it makes the mammogram really hard to interpret for some patients. And that's really important and it's key because mammography is not perfect. However, in certain groups of patients, such as women who do have dense breast tissue, it can serve a great tool and it can help us find some of these cancers. In addition to having the dense breast tissue seen on the mammogram, so we determine density on mammogram, and that's important to understand that. these women are actually eligible for supplementary screening. And what that means is we recommend patients undergo screening ultrasound. Screening ultrasound, it does not involve any radiation. It's actually very comfortable for patients. They're typically reclining on the stretcher. And
Little
it's
nap time.
that's right. And typically performed in a handheld fashion by the technologist. So the benefits of screening ultrasound in women undergoing mammography are huge. I mean, the cancer detection rates, meaning the additional cancers that we find, are clinically relevant. And again, they're early stage and small, but we want to find them. So basically, women who do have dense breast tissue have the option to have screening breast ultrasound. And in some cases, if the risk is high enough, they may elect to have a breast MRI.
So you've said that they have the option. Is it something they should do? And how do I know if I have dense breasts?
So as of this discussion, 38 states in this country have the density informed law that has been passed. So women should be notified of density on their mammogram. In Connecticut, we also have an insurance mandate. So women who do have dense breast tissue also have can have the screening ultrasound after they discuss with their physician, and those studies should be covered by insurance. So that's really helpful. Now, why does a patient elect not to have a screening ultrasound? Well, that's a personal choice. I can understand that. But one of the critiques of screening ultrasound is that perhaps maybe patients may be called back for every 6 months for some additional imaging, or there may be something that we find that we're not sure about, and a biopsy might be recommended. But again, those numbers are quite low.
So as you have said, most screening mammograms are completely normal, and patients are told to come back in a year for their next screening mammogram. But what if the results are not normal and I get a letter in the mail that I have to come back for additional imaging? Does that necessarily mean I have cancer? It's very scary. What does it mean?
I can completely sympathize with that. And I would like to point out that a majority of mammograms, about 90 to 95% of them, are normal. And that's important to remember that. A small proportion, about 10% or less patients, 10% or less patients, fewer patients, are recalled from screening mammogram because there's a questionable abnormality. But a questionable abnormality does not mean cancer. It just means that the interpreting radiologist isn't sure about what it is. Maybe it just needs a few extra pictures. So in that case, patients are recalled and additional imaging is performed. Sometimes we'll do extra pictures with mammography itself. And in some cases, patients will go on to have an ultrasound. And then a smaller subset will be recommended for a biopsy, which is also very scary. And we understand that. And those conversations, and typically the radiologist will come in and discuss the findings and the recommendations with the patient so that we can offer and deliver care in a very compassionate manner. But I'd like to point out that just because a woman is recalled from screening does not mean that she has cancer. In fact, most of the time, it's not cancer.
And I think that's an incredibly important message to get out there. I'm not sure it reduces the fear that any of us would have in getting that letter, but just something to keep in the back of your mind that most of the time, if you do get recalled, meaning called back for some more pictures, it is not cancer, and that's a good thing.
And as a corollary to that, it's also equally important to come back for additional imaging because while most of them are benign, there are a small proportion of women who will have cancers, and we don't want to let that go. So it's important to take it seriously and to come in and get the additional imaging as recommended.
Yeah, and that is why we're doing the mammograms to begin with, to the best of our ability, ensure that there's no cancer there at the time. You've spent a lot of time talking about screening mammograms. Are there other types of mammograms, or can you just let us know really what is a screening mammogram?
So, until 2011, all mammograms, there were digital mammograms, but there were just basically 2 pictures of each breast. But in 2011, there was a big shift in the market and new technology came into play, and that's tomosynthesis. And I really want to emphasize that tomosynthesis has now essentially become the standard of care, or will become the standard of care. And I know that Nuvance has really adopted tomosynthesis, and there are tremendous benefits associated with this technology. It's actually available at all sites in all hospitals, and pretty much all practices are 100% tomosynthesis at Nuvance. So what are the benefits? Well, first, we talked about some of the potential harms of screening mammography, which is kind of being called back and having these additional procedures. Well, that's reduced significantly tomosynthesis. Across multiple studies, that rate was slashed by almost 50%.
Wow.
That's fantastic.
That's enormous.
In addition, the cancer detection rate, meaning that the number of cancers that we're actually finding, went up by almost 40%, which is also equally important. And
so does that mean that there were cancers there and they just were not being detected? Because that's a scary thought in and of itself.
That's absolutely right. And that is particularly relevant in women with dense breasts. So tomosynthesis in women with dense breasts performs fantastically. So we're able to find additional cancers that previously would have been masked by some of this overlapping tissue. But even then, mammography and tomosynthesis is not perfect, because there is going to be a small subset of patients who have extremely dense breast tissue, whereby it's really hard, no matter how thin these slices are through the breast, we may not be able to find some of these cancers. So how is a tomosynthesis study different from a conventional 2D mammogram? For a conventional 2D mammogram, the patient is positioned and we just obtain one picture of in each projection. Whereas when a woman undergoes tomosynthesis, multiple low-dose images are taken at different angles and different projections, and then those are stacked together, and they almost create these 1 millimeter slices through the breast. It allows us to basically see through the breast from one end to the other, and it gives much more clarity and allows us to see right through dense breast tissue, and we can find some of these obvious and relevant lesions that need to be found.
So it sounds like it's almost the difference between a still picture, just a photograph, and a video.
That's right, exactly. And having that video, it gives us as radiologists more tools to actually decipher through the breast. And studies have actually shown that it's not just limited to women who have dense breast tissue. Right. Even women who don't have dense breast tissue benefit from having tomosynthesis, because going through the breast in 1 millimeter sections sometimes allows us to find some of those subtle findings that we may easily miss on a 2D mammogram.
Is there any reason not to have tomosynthesis if it's available?
I can't think of a single reason.
Okay. That's a great answer. It's very straightforward.
I know that patients have some concerns related to radiation. Well, the radiation for tomosynthesis is almost equivalent to a regular 2D mammogram. And depending on the vendor, it may be slightly higher, but the vendors that are at least present here in Connecticut, the radiation dose is very similar, and it's well below what is FDA mandated. So that's really important to remember too. So it's a better mammogram, right. It's a better study. And we would encourage all our patients to have it.
Yeah, it really sounds as though there's no downside to that.
That's right.
So I'd be remiss if I did not ask something related to COVID, given that we still are in a COVID world. And my understanding is that during the peak of COVID, that screening mammography was really shut down and it wasn't taking place. If women had specific symptoms, they could get mammograms, but routine mammograms were not taking place. And also, as you can understand, and I certainly understand, that women are hesitant to come back and they're a little nervous about going into any healthcare facility. What protocols are in place to ensure that it's as safe as can be? And what can we tell women about the importance of coming back to get your screening mammograms?
It's a very important question, Susan, very apt and relevant. We want our patients to come back. And I want to emphasize that we understand the gravity of the situation. We understand how important it is to be safe, to be clean. And that's what we're providing for our patients. So let me just walk you through what a patient would actually go through if they were to come to our facility, right? So first of all, they're registering through their own cell phone from their car. So we're not even bringing in patients to wait in the waiting room. We're just bringing them one at a time when we're ready to bring them in. So they may have an appointment at a certain time. We're sensitive about that, and we're bringing them in at the time that they're supposed to come in. But it's really one at a time.
That already sounds safer to me.
Right. And we're also very careful about not having, in the past we used to have patients would bring in family members, but now we've basically minimized that to just the patient. While that's very difficult for some patients, especially if they're undergoing a biopsy or other procedures, our staff is very sensitive to the fact that this is a sensitive part of the body, and we want to make sure that we take care of our patients in a compassionate manner. So that compassion will always be there. Mm-hmm. Once a patient comes in, they're taken into a specific room, they're asked questions. Now they're going to remain in that room for the duration of their time. And prior to their arrival into that room, everything's been wiped down, everything's been cleaned, including the mammography machine or the ultrasound machine, the ultrasound probe. Patients are offered clean sheets, they're given clean gowns, they undergo their study, they undergo their exam, and if the radiologist needs to come in and speak to them, they will come in and speak to them in that room. Everybody's using masks. We have appropriate PPE for our staff because we want to protect our staff as well, and for our patients. And prior to, actually, I should mention this, prior to the patients actually entering the facility, we take temperatures to make sure that they're healthy, and we ask them questions about where they've, the appropriate screening questions. Now, when the patients leave, they're again whisked off through a separate exit, so they're safe again, and there are no patients that are currently waiting. So we're doing our best in terms of implementing robust protocols, our staff, to protect our staff and to protect our patients. So I'd like to emphasize that we have everything in place, and we want our patients to come back for their screening mammograms. It's time.
That's really, I think the key message is we are doing everything to ensure not only our patient safety, but the staff safety also. And we're doing that so that patients, and specifically for this topic, women will come back in order to take care of their own health in a safe manner. And that is, if you're over 40, by getting yearly mammograms.
That's right.
Any other points, Dr. Raghu, that we haven't gotten across that would be important to get across to anyone watching this?
This is actually an exciting time for breast imaging and breast health in general. And I think what I'd like to emphasize that we at Nuvance Health, we're poised for our patients during these difficult times, but we're also poised for the future. And that includes, really reinventing and rethinking how we screen patients for breast cancer. While mammography is a great tool, there are lots of things on the horizon that will really help us detect breast cancers. And what's important to realize is that there's a great team of physicians and other staff that are here to welcome and take care of these patients, and we're ready to move things into the future.
Well, thank you so much. This has been incredibly educational, and I hope that you'll join us again soon.
Oh, thank you so much. And
Okay.
don't forget your mammogram.
All right. Everyone go out and get your mammogram. Thanks very much.
Thank
Bye.
you.